What doctors wish you knew before a hair transplant. You've seen the insane before and afters, the celebrity reveals, the promise of a perfect hairline, and you think, I need that. Now, it's easy to think you can just buy new hair. You walk in thinning, and you walk out with a god-tier mane, right? But that one single idea, that this is an overnight fix, is the biggest reason people freak out and regret their decision. It's a fantasy that slams into a wall during the healing process, especially during a crazy part they call the ugly duckling phase. That's when your brand new hairs literally fall out, and you're left looking in the mirror thinking you made the biggest mistake of your life. It doesn't have to be like that. A legendary hair transplant isn't just about the surgeon, it's about you knowing what's actually going to happen. So today we're dropping the 5 massive truths your surgeon is begging you to know before you even call them. Getting this straight won't just save you from insane stress. It'll guarantee you get a result you'll actually love for years. All right, let's destroy the biggest myth right now. The idea that you walk out of the clinic with a perfect head of hair. The ads show you the start and the finish, but they conveniently skip the entire 12-month journey it takes to get there. Here's the reality check your doctor needs you to have. A hair transplant is a slow burn. This is farming, not flipping a switch. You don't plant seeds and wake up to a jungle the next day. You plant the seeds and then you have to wait and wait and wait. On surgery day, the surgeon places thousands of tiny hair grafts. You'll leave seeing the outline of your new hairline, but, and this is huge, that's not the hair you get to keep. In the first few weeks, something insane happens called shock loss. The new hairs and even some of your old hairs will literally fall out. This is 100% normal. It's just the hair follicles hitting the reset button after being moved. This is that ugly duckling stage, and it's where everyone panics, but you have to go through it. Real new growth only starts showing up around month 3 or 4. At first, it's super fine and sparse. By 6 months, you'll see a massive difference, like over half the final result. But you won't see the grand finale until a full year has passed, when the hairs thicken up and mature. So the first thing you need to know is this. Patience isn't just a good idea on this journey, it's a requirement. That amazing after photo is the final level, but there's a 12-month grind to get there. When you picture a hair transplant patient, who do you see? A dude, right? The ads and articles only focus on guys. This has created a crazy myth that transplants are a men-only club, leaving millions of women thinking this incredible solution isn't for them. Let's be clear, hair loss does not discriminate, and neither does hair restoration. Women can be amazing candidates for a hair transplant. Yeah, female hair loss can look different, usually more thinning all over, but tons of women have a stable, healthy donor area on the back of their head, just like men. For women dealing with traction alopecia from hairstyles, hair loss from scars, or just a clear pattern of thinning, this can be life-changing. On top of that, a transplant can be a game-changer for women who just want to lower a high hairline, which has nothing to do with hair loss at all. A doctor's meeting with a woman might be more detailed, maybe with some blood tests, but the mission is the same. If you have hair loss in one spot and a ton of healthy hair in another, a transplant is possible. Surgeons literally customize their techniques for female hair patterns. So let's kill this myth right now. Hair restoration is not a men's-only club. It's for anyone, man or woman, who wants to get their hair back. There's a ghost that haunts the hair transplant industry, the ghost of old, terrible transplants. So many people hear hair transplant and immediately picture that unnatural doll's hair or cornrow look from decades ago. This fear of looking like you've obviously had work done is one of the biggest reasons people don't even try. Here's the deal. That pluggy look is a fossil. It's dead. Modern hair transplantation is more art than science. With insane techniques like FUE, surgeons aren't using giant plugs anymore. They're extracting individual follicular units, that's tiny, natural groups of 1 to 4 hairs, and placing them one by one. This lets a surgeon design a hairline like an artist. They use the thinnest, single hair grafts at the very front to make it look soft and natural. They control the angle, direction, and density of every single hair to perfectly copy your natural growth. The result, when done by a pro, is completely undetectable. The goal isn't just to add hair, it's to create a result so good that not even your barber knows. This is why your surgeon is everything. Their skill is the only thing separating a masterpiece from a disaster. So when you're looking at clinics, don't just look at the price. Stare at their before and afters. Look at the hairlines. Are they soft? Are they a little imperfect, like real hair? A great modern transplant shouldn't look like a transplant at all. It should just look like your hair. We just busted 3 huge myths, but we still have 2 of the most important truths to go. I have a challenge for you. What's the one thing you've heard about hair transplants that's been holding you back? Drop it in the comments below. I want to see what's on your mind. And if you're finding this helpful, do me a favor and smash that subscribe button. We're all about giving you the real, no hype facts for your hair journey. The idea of any surgery is scary, and let's be real, the thought of thousands of tiny cuts on your scalp sounds terrifying. A huge fear for people is that a hair transplant will be pure agony. Let's clear the air. The truth is, the vast majority of patients report little to zero pain during the procedure. It's all done with local anesthesia, just like when you get a cavity filled. You'll feel the first few numbing shots. It's a quick sting, but after that, your scalp is completely numb. Patients are awake the whole time, literally chilling out watching movies, listening to music, or even taking a nap. Most people just say it feels like weird pressure or pulling, but not pain. And what about after? Even that is super mild. People say it feels like a light sunburn, and the painkillers the clinic gives you will handle it easily. Any swelling usually disappears in a few days. In fact, most people are back to work in just a couple of days. Honestly, the anxiety you feel before the procedure is almost always 100 times worse than anything you feel during or after it. Don't let the fear of a few days of feeling a little sore stop you from something that could permanently change your life. This last one sounds like it's from a sci-fi movie, but you would be shocked how often doctors get asked this. My brother has incredible hair. Can he be my donor? The answer is a hard biological no. You can only use your own hair, period. Your body's immune system is like a bouncer at an exclusive club. It spots and attacks any tissue it doesn't recognize. If a hair follicle from another person was put in your scalp, your body would immediately see it as an enemy invader and destroy it. Not only would the transplant fail completely, but you could get some nasty side effects. It's the same reason organ transplant patients have to take crazy powerful drugs for life. And those drugs are not happening for a cosmetic procedure. The donor hair has to come from your own safe zone, usually the back and sides of your head. The hair there is genetically programmed to be immune to the hormone that causes baldness. That's why you see guys who are bald on top but still have that perfect ring of hair in the back. Those follicles keep that superpower even when they're moved to a new spot. This is the entire principle that makes a hair transplant permanent. You're not stopping hair loss. You're just moving hair that can't be lost. And this also explains why not everyone can get one. If you don't have enough healthy donor hair to spare, a transplant isn't an option. It's a closed system. Your own hair is the only thing you have to work with. So, let's do a rapid-fire recap of the 5 truths your doctor wants you to know. 1. Results are not instant. It's a 12-month marathon that demands patience. 2. It is not just for men. Women can get incredible life-changing results. 3. Modern transplants don't look fake. New techniques create undetectable results. 4. The procedure is not crazy painful. The discomfort is super mild and easy to manage. And 5. It has to be your own hair. Your body will reject anyone else's, 100% of the time. Getting these 5 truths straight is the single best thing you can do for a successful transplant. When your expectations are realistic, you can go through this with confidence instead of freaking out. The final outcome depends on 2 things: the insane artistic skill of your surgeon and you understanding the journey. Do your homework, choose a doctor you trust, and get ready for a pretty wild transformation. If you're ready to take the next step, check out our video on how to choose the right hair transplant clinic right here. Thanks for watching, and we'll see you in the next one.